world.
This is the English service of Radio Algeria International. It's time for the news.
The Interior Minister Brahim Merad has highlighted the particular interest paid by Algeria to the border region with Tunisia through the implementation of development programs. Foreign Minister Ahmed Hattaf has highlighted in Rome Algeria's effort to establish tangible partnerships to strengthen energy security and transition in Africa and the EU-Mediterranean region. The European Union has deplored the decision of the Malian transition authorities to denounce the peace and reconciliation accord in Mali stemming from the Algiers process. About 20 have jointly expressed deep concern and outrage that some of the largest donors have suspended funding for the United Nations Relief and Work Agency, UNRWA, the main aid provider for millions of Palestinians in Gaza and the region. Those were the major developments. Now the Fuel News edition. Good afternoon. Prime Minister Nadir El-Habawi has received at the government palace here in Algiers the Tunisian Interior Minister Kamel Feki, who is now on a working visit to Algeria. The visit of the Tunisian Interior Minister comes within the framework of the first session of the Bilateral Commission for the Development and Promotion of the Algerian-Tunisian border regions. Both officials welcome the deep brotherly bonds of solidarity which unite both peoples and countries in accordance with the common will for the leaders of both Algeria and Tunisia. They also hailed the political convergence they have on regional and international issues. The two parties reviewed the conclusions of the first session of this bilateral mechanism, affirming their common attachment to implementing them. And now the Interior Minister Brahim Merad has highlighted the particular interest paid by the President Abdelmajid Tebboune to the border region through the implementation of development programs to improve the living conditions of their inhabitants. More details with Asya Bakkar.
The statement was made at the opening of the first session of the Algeria-Tunisia Bilateral Commission for the Promotion and Development of Border Regions, which he co-chaired with his Tunisian counterpart, Kamel Feki. Mr. Merad highlighted the importance of developing these regions, given their importance for passengers and commercial exchanges.
In
order to ensure our development, we have to secure our common bordering regions and protect them from the current security threats, notably illegal migration, and that by intensifying security discussions and coordination in line with the security accord signed between our countries in March 2017, which provided for implementing a follow-up committee to the common security issues.
The Tunisian Interior Minister Kamel Feki, for his part, highlighted the fruitful and constructive security coordination between Algeria and Tunisia on the border strip, stressing that the security and stability of Tunisia is linked to that of Algeria. The Tunisian minister stressed that counterterrorism cannot be achieved without the adoption of a global approach based mainly on improving the living conditions of the inhabitants of these regions. He added that the creation of the Bilateral Commission for the Promotion and Development of Border Regions gave a strong impetus for development programs.
We want this meeting to become a new framework to deepen discussions among the governors on the programs and projects that aim at improving and developing services for the benefit of both our brotherly peoples. In the bordering regions, we want to give a new impetus to their development to help in reinforcing security and stability and to make a common strategy to develop these regions in accordance with the characteristics of each province and its different features.
Let's note that the first session of the Algeria-Tunisia Bilateral Commission for the Promotion and Development of Border Regions wound up today, Tuesday.
The President of the Italian Council of Ministers, Giorgia Meloni, and the ongoing President of the African Union, Azali Assoumani, has expressed satisfaction at the outcome of the Italy-Africa Summit held in Rome in the presence of African leaders with a view to laying the foundation for cooperation and partnership in a number of areas. More in this report by Assia Bekkar.
In the last press briefing held with the President of the AU, Mrs. Meloni said she was extremely satisfied with the work accomplished, adding that her country had chosen to elevate the Italy-Africa Conference to summit status. She stressed that concrete facts had been taken as a starting point and not just a philosophy, with the aim of replicating the most successful models in all countries that are interested and to work out other projects with the contribution of African nations. She added that today bilateral meetings and a wide-ranging process of exchange and sharing was taking place. For his part, the ongoing chairman of the African Union, Azali Assoumani, also expressed his satisfaction at the results of the summit, describing the meetings as successful and said that it was an opportunity to learn from the African experience in order to move towards a better future. On this occasion, the chairman of the AU highlighted the plan for Africa, saying that it was a good plan to be effective. However, it needs to be progressively revised and adopted. The Italy-Africa Summit is attended by the Minister of Foreign Affairs and National Community Abroad, Ahmed Attaf, representing the President of the Republic, Abdelmajid Tebboune. Speaking at the summit, Mr. Attaf called for investment in the infrastructure sector, particularly in vital areas such as energy, transport and telecommunication, emphasizing the efforts of Algeria and the African continent aimed at implementing projects with regional and complementary dimension. He also stressed Algeria's efforts to establish tangible partnerships to strengthen energy security and transition in Africa and the Euro-Mediterranean region. Mr. Attaf, who met with his Italian counterpart Antonio Tajani on the sidelines of the summit, has reiterated his congratulations to Italy for its initiative to hold the summit and for the launch of the Matai Plan for Africa, expressing Algeria's readiness to contribute to the success of the plan and to the achievement of the objectives set at various levels.
And now the Foreign Minister, Mr. Ahmed Attaf, has held a series of meetings in Rome with his counterparts from Benin, Mauritania, Tunisia, Madagascar and Côte d'Ivoire as part of his participation at the Italy-Africa Summit. The talk focused in particular on relations between Algeria and its sister states and ways of promoting them to the highest levels. The meetings also provided an opportunity for consultation and coordination on issues on the summit agenda, but also to discuss the latest international and regional developments and the common challenges to be taken up by the African states and peoples. Mr. Attaf also met with the Director General of the International Organization for Migration, Amy Pope, to whom he reiterated Algeria's support and expressed her full willingness to pursue joint actions to strengthen cooperative relations between the two parties. And now the Speaker of the National People's Assembly, Ibrahim Roughali, has received the Speaker of the National Assembly of the Republic of Madagascar, Christine Razanama-Assoug, accompanied by a delegation. Mr. Roughali stressed that the meeting was an opportunity to discuss how to strengthen bilateral relations, which share several common historical denominators and are seeking to converge towards promoting the continent's potential. After calling for the strengthening of bilateral relations on the parliamentary plan through the two parliamentary friendship groups and the strengthening of consultation and coordination during the various regional and international forums, the head of the Assembly insisted on the imperative of promoting economic relations to support the process of cooperation at political level. The Minister of Culture and Art, Soraya Mouloudj, has received here in Algiers the Director General of the UNESCO, Eric Foltz, for a meeting on the means to reinforce the cooperation between the Ministry and UNESCO in the field of cultural heritage protection. During the meeting, Soraya Mouloudji reviewed the considerable efforts made by Algeria to protect, preserve and add value to its cultural, tangible and intangible heritage. The meeting was an occasion to discuss several questions linked to the inscription to the World Heritage List of new Algerian sites and material goods, as well as the preparation for files regarding the nomination of the intangible cultural heritage and its ranking on the representative list of intangible cultural heritage of humanity. The two parties also discussed the importance of strengthening the regional center for the safeguarding of intangible cultural heritage in Africa, located in Algeria, as well as the possibility to reinforce the scientific capacities and the workers' technical expertise in the field of heritage through the organization of training courses supervised by the UNESCO experts. At the end of the meeting, the minister officially invited UNESCO Director General to take part in the International Symposium on Underwater Cultural Heritage, which will be hosted by Algeria on February 26. And now the European Union has deplored the decision of the Malian transition authorities to denounce the Peace and Reconciliation Accord in Mali, stemming from the Algiers process. The EU diplomacy said the civilian populations of northern Mali would be the first to suffer the consequences of this unilateral decision. The EU diplomacy said the rupture may lead to a national and regional disequilibrium, while no alternative to the 2015 peace accord has yet emerged. The European Union remains convinced that the inclusive dialogue advocated by Algeria in her capacity as leader of the international mediation must be privileged to resolve differences and promote a lasting peace in the northern part of Mali. And now about 20 NGOs have issued a joint statement expressing deep concern and outrage that some of the largest donors have united to suspend funding for the United Nations Relief and Works Agency, UNRWA, the main aid provider for millions of Palestinians in Gaza and the region. This comes amid a rapidly worsening humanitarian catastrophe in Gaza. More details with Jamil Samani.
The organizations, including Oxfam, the Norwegian Refugee Council and Save the Children, among others, has said the suspension of funding by donor states will impact life-saving assistance for over 2 million civilians, over half of whom are children, who rely on UNRWA aid in Gaza, adding that the population faces starvation, looming famine, and an outbreak of disease under Israel's continued indiscriminate bombardment and deliberate deprivation of aid in Gaza. The NGOs hailed UNRWA's swift investigation into the alleged involvement of a small number of UN staff members in the 7th October, expressing shock about the reckless decision to cut a lifeline for an entire population by some of the very countries that had called for aid in Gaza to be stepped up and for humanitarians to be protected while doing their job. This decision comes as the International Court of Justice ordered immediate and effective action to ensure the provision of humanitarian assistance to civilians in Gaza. 152 UNRWA staff have already been killed and 145 UNRWA facilities damaged by bombardment. UNRWA is the largest humanitarian agency in Gaza, and their delivery of humanitarian assistance cannot be replaced by other agencies working in Gaza. The NGOs have said if the funding suspensions are not reserved, they may see a complete collapse of the already restricted humanitarian response in Gaza, with approximately over 1 million displaced Palestinians taking shelter in or around 154 UNRWA shelters. The agency and aid organizations have continued to work in near impossible circumstances to provide food, vaccinations and fresh water. The country suspending funds risk further depriving Palestinians in the region of essential food, water, medical assistance and supplies, education and protection. The organizations urge donor states to reaffirm support for the vital work that UNRWA and its partners do to help Palestinians survive one of the worst humanitarian catastrophes in our times, stressing that countries must reverse these funding suspensions, uphold their duties towards the Palestinian people, and scale up humanitarian assistance for civilians in dire need in Gaza and the region.
And now UN Secretary General Antonio Guterres is due to meet the main donors of the United Nations Agency for Palestinian Refugees, UNRWA, while NGOs have launched an appeal to ensure that funds continue to be channeled to Gaza, which has been subjected to a genocidal aggression by the Israeli occupation since October 7th. The spokesman for the Secretary General, Stéphane Dujarric, said that the message to donors, in particular those who have suspended their contribution, it's at least ensure the continuity of UNRWA's operation because there have thousands of dedicated employees working throughout the region. Dujarric stressed the necessity to meet the urgent needs of desperate residents.
The Secretary General has also been engaging with the UNRWA leadership and donors to UNRWA, as well as regional leaders such as King Abdullah of Jordan, who he spoke to a short while ago, and President Sisi of Egypt, with whom he will speak a bit later this afternoon. The Secretary General is personally horrified by the accusations against employees of UNRWA, but his message to donors, especially those who have suspended their contribution, is to at least guarantee the continuity of UNRWA's operations, as we have tens of thousands of dedicated staff working throughout the region. The dire needs of the desperate population they serve must be met. At this point, the outlook for UNRWA and the millions of people it serves, not only in Gaza, but also in East Jerusalem, in the West Bank, Jordan, Lebanon, and Syria, is very bleak.
That was the spokesman of the Secretary General, Stefan Dujarric. I invite you now to listen to our health magazine compiled and presented by Mohamed Khatel.
Hello and welcome to this new edition of your weekly program, The Health Magazine. The week between January 22nd and January 28th is Cervical Cancer Prevention Week. This Prevention Week is a dedicated awareness campaign aimed at educating people about cervical cancer, its prevention, and the importance of regular screenings. Cervical cancer is a largely preventable disease, and this week serves as a reminder to prioritize cervical health and take steps to reduce the risk of this type of cancer. Cervical Cancer Prevention Week has been observed for many years and has played a crucial role in raising awareness about cervical health. It was established to honor the memory of Jade Goody, a well-known British reality television star who tragically passed away from cervical cancer at a young age. Her story highlighted the importance of early detection and prevention. Despite being a preventable and curable disease, cervical cancer is responsible for a large burden of suffering in women around the world, especially in low and middle income countries. To uphold the right to health for adolescent girls and women, it is important that disparities in access to high-quality health services are addressed. Cervical cancer develops in a woman's cervix, which is the entrance to the uterus. Almost all cervical cancer cases, or 99%, are linked to infection with high-risk human papillomavirus, HPV, an extremely common virus transmitted through sexual contact. Although most infections with HPV resolve spontaneously and cause no symptoms, persistent infection can cause cervical cancer in women. Cervical cancer is the sixth most common cancer in women in the Eastern Mediterranean region. Now, what are the causes of cervical cancer? Human papillomavirus, HPV, is a common sexually transmitted infection which can affect the skin, genital area, and throat. Almost all sexually active people will be infected at some point in their lives, usually without symptoms. In most cases, the immune system clears HPV from the body. Persistent infection with high-risk HPV can cause abnormal cells to develop, which go on to become cancer. Persistent HPV infection of the cervix, if left untreated, causes 95% of cervical cancers. Typically, it takes from 15 to 20 years for abnormal cells to become cancer, but in women with weakened immune systems, such as untreated HIV, this process can be faster and take 5 to 10 years. Risk factors for cancer progression include the grade of oncogenicity of the HPV type, immune status, the presence of other sexually transmitted infections, number of births, young age at first pregnancy, hormonal contraceptive use, and smoking. How to prevent cervical cancer? Boosting public awareness, access to information and services are key to prevention and control across the life course. Being vaccinated at 9 to 14 years is a very effective way to prevent HPV infection, cervical cancer, and other HPV-related cancers. Screening from the age of 30, 25 years in women living with HIV can detect cervical disease, which when treated also prevents cervical cancer. At any age with symptoms or concerns, early detection followed by prompt quality treatment can cure cervical cancer. The head of the International Agency for Research on Cancer Screening Group at the World Health Organization WHO, Dr. Partha Basu, gives us an overview of the world burden of cervical cancer and how IARC is working to eliminate this preventable disease.
Cervical cancer is a major killer disease among women. Every year, more than 300,000 women die of this cancer, and unfortunately, more than 80% of those women are from the low and middle income country. This is all the more tragic because this is a cancer that can be fully prevented by vaccination of the adolescent girls and screening of the women. At IARC, we have several research projects that are aimed at improving the access to vaccination and cervical cancer screening. We have a project that is looking at the efficacy of a single dose of the HPV vaccine. As you know, currently the vaccine is recommended for 2 doses, but then our early results show that even single dose can be as efficacious as 2 doses. This will bring down the cost and the complexities of the program. We have research projects that are looking at different alternative screening tests, the technologies to treat cervical precancers in an affordable and simple way, and we also have research projects that are aimed at improving the quality of cervical cancer screening around the world. This project we call Cancer Screening in 5 continents. We share the outcomes of our research with the WHO so that the evidence can inform policies and guidelines all over the world.
HPV vaccination and other prevention steps. As of 2023, there are 6 HPV vaccines available globally. All protect against the high-risk HPV types 16 and 18, which cause most cervical cancers and have been shown to be safe and effective in preventing HPV infection and cervical cancer. As a priority, HPV vaccines should be given to all girls aged between 9 and 14 years old before they become sexually active. The vaccine may be given as 1 or 2 doses. People with reduced immune systems should ideally receive 2 to 3 doses. Some countries have also chosen to vaccinate boys to further reduce the prevalence of HPV in the community and to prevent cancers in men caused by HPV. Other important ways to prevent HPV infection include being a non-smoker or quitting smoking, using condoms in addition to voluntary male circumcision, cervical screening and treatment of precancers. Women should be screened for cervical cancer every 5 to 10 years, starting at age 30. Women living with HIV should be screened every 3 years, starting at age 25. The global strategy encourages a minimum of 2 lifetime screens with a high-performance HPV test by age 35 and again by age 45. Precancers rarely cause symptoms, which is why regular cervical cancer screening is important even if you have been vaccinated against HPV. Self-collection of a sample for HPV testing, which may be a preferred choice for women, has been shown to be as reliable as samples collected by healthcare providers. After a positive HPV test, a healthcare provider can look for changes on the cervix, which may develop into cervical cancer if left untreated. Treatment of precancers is a simple procedure and prevents cervical cancer. Treatment may be offered in the same visit or after a second test, which is especially recommended for women living with other health conditions. Treatment of precancers are quickly and generally painless, causing infrequent complications. Treatment steps include colposcopy or visual inspection of the cervix to locate and assess the lesion, followed by thermal ablation, which involves using a heated probe to burn off cells. Cryotherapy, which involves using a cold probe to freeze off cells, and leads large loop excision of the transformation zone, which involves removing your abnormal tissues with an electrically heated loop. And a cone biopsy, which involves using a knife to remove a cone-shaped wedge of tissue. Early detection, diagnosis, and treatment of cervical cancer. Cervical cancer can be cured if diagnosed and treated at an early stage of disease. Recognizing symptoms and seeking medical advice to address any concern is a critical step. Women should see a healthcare professional if they notice unusual bleeding between periods, after menopause or after sexual intercourse, increased or full-smelling discharge, symptoms like persistent pain in the back, legs, or pelvis, weight loss, fatigue and loss of appetite, and swelling in the legs. Clinical evaluations and tests to confirm a diagnosis are important and will generally be followed by referral for treatment services, which can include surgery, radiotherapy, and chemotherapy, as well as palliative care to provide supportive care and pain management. Management pathways for invasive cancer care are important tools to ensure that a patient is referred promptly and supported as they navigate the steps to diagnosis and treatment decisions. Feeders of quality care include a multidisciplinary team ensuring diagnosis and staging. Treatment decisions in line with national guidelines and interventions are supported by holistic psychological, spiritual, physical, and palliative care. As low and middle income countries scale up cervical screening, more cases of invasive cervical cancer will be detected, especially in previously unscreened populations. Therefore, referral and cancer management strategies need to be implemented and expanded alongside prevention services. WHO response. All countries have made a commitment to eliminate cervical cancer as a public health problem. WHO global strategy defines elimination as reducing the number of new cases annually to 4 or fewer per 100,000 women, and sets 3 targets to be achieved by the year 2030 to put all countries on the pathway to elimination in the coming decades. 90% of girls vaccinated with the HPV vaccine by age 15, 70% of women screened with a high-quality test by ages 35 and 45, and 90% of women with cervical disease receiving treatment. Modeling estimates that 74 million new cases of cervical cancer can be averted and 62 million deaths can be avoided by reaching this elimination goal. Prevention of HPV-associated pre-cancer and cancer is also a key element of WHO's global health sector strategy on HIV, hepatitis, and sexually transmitted infections 2022-2030. In addition to all the prevention means mentioned above, sensitization remains the key factor to remind people of the seriousness of this disease. Participating in Cervical Cancer Prevention Week 2024 is a duty towards the community that everybody should perform. So how to participate in this awareness-raising efforts? There are several ways to get involved and support Cervical Cancer Prevention Week. Share information, spread the word about cervical cancer prevention by sharing information and resources on social media. Encourage your friends and family to learn about the importance of screening and vaccination. Attend a screening. If you are eligible for cervical screenings, schedule an appointment with your healthcare provider. Regular screenings can detect abnormal cell changes early, which can prevent cervical cancer. Support HPV vaccination. Support efforts to vaccinate eligible individuals against HPV, which is a leading cause of cervical cancer. Encourage vaccination for yourself or your children if recommended by healthcare professionals. Organize or attend events. Look for local events, webinars, or workshops related to cervical cancer prevention during this week. Participate in these activities to gain more knowledge and meet others who are passionate about the cause. Donate or volunteer. Consider donating to organizations dedicated to cervical cancer prevention or volunteering your time to support their initiatives. Cervical Cancer Prevention Week has been observed for many years and has played a crucial role in raising awareness about cervical health. And to wind up this program, I leave you with a sensitization ad broadcast by the World Health Organization WHO to fight against this harmful disease. And bye-bye for now.
1,000 lives were lost to cervical cancer, and the problem could soon be much worse. But right now, we can come together to eliminate this cancer for good. If by 2030, we can have 90% of girls vaccinated, 70% of women screened for early signs of cancer, and 90% of patients receiving treatment, in the coming years, we can save millions of women's lives. Each one a daughter, a partner, a mother, a friend. Together, we can create a cervical cancer-free future.
Sintonizan Radio Argelia Internacional. El diario hablado.
Vayamos con los titulares de nuestra edición. El primer ministro Nader al-Arbaoui recibe en Argel al ministro tunecino del Interior Kamel Fekki de visita de trabajo a nuestro país en el marco de la primera sesión de la Comisión Bilateral para el Desarrollo y la Promoción de las Regiones Fronterizas Argelino-Tunecinas. El ministro de Asuntos Exteriores y Comunidad Nacional en el extranjero, Ahmed Attaf, insiste en los esfuerzos de Argelia destinados a materializar asociaciones palpables que han de fortalecer la seguridad y la transición energéticas en África y en la región euromediterránea. Continúa por 116º día consecutivo el genocidio de la entidad sionista contra la Franja de Gaza, donde 26.751 palestinos han caído en mártires desde el pasado 7 de octubre. Una veintena de ONGs internacionales manifiestan su indignación por la actitud irresponsable de 12 países de suspender la ayuda a la Agencia de la